Have you started forgetting words, rooms, or names after 50 while secretly fearing your mind is beginning to slip? And what if the first place to look is not your brain, but the pill routine you trusted today? I am Dr. Thomas Bennett, and I see this fear in careful families often. Today, I will explain it plainly.
Your health and
No
safety
panic
are
here.
my top priorities.
You will learn why memory trouble can
Rest
begin
assured,
outside the brain.
you are in capable
That sounds
hands
strange,
here.
but it happens.
No panic.
Stay with me,
Let's
because
take a
the most
closer look
important
together.
danger is a hidden medication pattern. Welcome, and thank you for being here.
Okay, doctor.
Memory changes after 50 can frighten even the strongest people. I understand that. A person walks into the kitchen and forgets why they came. A husband repeats the same question before lunch. A wife loses a simple word in the middle of a sentence. A daughter notices her father seems foggy after sleeping all night. The family starts whispering about dementia because that is the fear everyone knows. But as a doctor, I want you to check another place before assuming the worst. Sometimes the brain is responding to something ordinary, familiar, and trusted. It may be a prescription taken for years. It may be an over-the-counter sleep aid bought without a second thought. It may be a pill for allergies, reflux, bladder
Before
symptoms,
assuming
pain,
cognitive issues,
anxiety,
consider
or
the side
mood.
effects of your
One
current
item
medication.
alone does not always explain everything.
Exactly.
But several
Rule out
together
medication
can
side
quietly
effects first.
change how a person thinks, remembers, sleeps, and reacts. This is not a message to stop your medicine. Please hear that clearly. Some medications protect your heart, control blood pressure, prevent dangerous clots, or treat serious illness. Stopping suddenly can be dangerous. A strong doctor's warning is not, quit the pill. A strong doctor's warning is, review the whole list before blaming age alone. That question can change everything. After 50, this matters more because the body often carries several health problems at once. Sleep becomes lighter. Pain becomes common. Allergies continue. Reflux shows up after meals. Bladder urgency interrupts the night. Anxiety can rise during retirement, caregiving, grief, or loneliness. So one medicine becomes two becomes
Before
four.
assuming cognitive issues,
Then a weekly
consider the
pill
side effects of
organizer
your
starts
current
looking
medication.
normal on the
Always check
kitchen
the
counter.
interactions.
That
Exactly.
is where the
Rule
clue
out medication
hides.
side effects
Your
first.
liver and kidneys also clear some drugs more slowly with age. The brain becomes more sensitive to drowsiness, dehydration, low blood pressure, and chemical effects that were once easier to tolerate. A medicine that felt harmless at 40 can feel very different at 65. A nighttime pill can still cloud the morning. A daytime medicine can slow attention. Another can dry the mouth, disturb sleep, or worsen confusion during illness. Families miss the pattern because every pill has a reason. One was prescribed after surgery. One came from a pharmacy shelf. One was added for sleep during a stressful month. One was meant to be temporary, but stayed. No single moment feels dramatic, so nobody connects the dots. Then the person becomes forgetful, slower, or less like themselves. That is the dangerous silence. And it is especially painful when everyone jumps straight to the worst explanation. Dementia is real, and it deserves serious attention. But before assuming the brain is permanently failing, a careful medication review is one of the smartest first steps. It can reveal timing problems, overlapping side effects, or combinations that deserve a safer discussion with a doctor or pharmacist. Again, do not change anything alone. Write it all down. Include prescriptions, sleep aids, allergy pills, stomach medicines,
You'll
pain
want to review
relievers,
the whole list,
bladder
step
pills,
by step.
supplements,
We will, doctor.
and
Thank
anything
you.
used only
Thanks, Doc.
sometimes. Bring that list to someone qualified to review it.
This shows the
The
timing
goal is
and
not
overlap.
fear.
If we
The
adjust
goal is
this,
clarity.
we can avoid the side
Many
effects.
older adults
the
are told
combination
to
should be safe now?
just
Yes,
accept
absolutely.
fogginess as age. But age should never become a blanket that hides correctable medication risks. In this video, we will go through 9 everyday medication groups that deserve attention after 50. I will explain why they can look like aging, why the stacking effect matters, and which clues should make you ask better
Here's
questions.
my list.
Near
Thank
the
you.
end,
We will review
I
it
will also
carefully.
share
We
a
are here to
simple
help and ensure
10-second
your
medicine
medications are
cabinet
right for
tip
you.
for older
appreciate
adults
it.
and caregivers.
Of course, let's keep working
It will
together.
not replace medical
your
advice,
family safe.
but it can help you walk
Check
into
these
your next
9 groups
appointment
of medication
prepared, alert, and
stay
protected.
tuned for
Number
a
9 is the
10-second
pill
tip.
many people do not even count as medicine. It sits beside the bed as a sleep aid or in the bathroom cabinet as an allergy tablet. A reasonable person takes it because the label looks familiar, the nose is running, or sleep has become difficult after 50. The trap is that many PM products and older allergy pills can act like a chemical dimmer switch for the brain. The concern is not only drowsiness. Many of these products block acetylcholine, a messenger your brain uses for attention, memory, and clear thinking. After 50, that blockage can feel like missing words, slower reaction time, dry mouth, constipation, or waking up confused instead of rested. It can also make a person look careless when they are not careless at all. This is why families miss it. They see the forgotten name, the repeated question, or the morning confusion, but they never look at the little blue tablet taken the night before. Because it came from a store shelf, it feels harmless. Because it helps sleep once, it becomes a habit. Do not panic and do not throw anything away tonight. Bring the exact bottle to your doctor or pharmacist and ask, is this anticholinergic, and is there a safer choice for sleep or allergies? That one question can uncover a hidden burden before it looks like aging. How many adults over 50 are blaming memory slips on aging, while the real clue may be hiding in a medication list no one has reviewed? If this gave you your first real warning today, comment "review" right now and let that one word remind you for the long run. Before fearing dementia, review every medicine, dose, and combination with a qualified doctor or pharmacist. And the next medication hides behind a completely different reason. Number 8 is the reflux pill that starts as relief and quietly becomes routine. Heartburn can be miserable. A person eats dinner, feels burning in the chest, takes a proton pump inhibitor, and finally sleeps. Used correctly, these medicines help many people. The problem begins when a short-term plan turns into months or years without anyone asking why it is still there. The memory concern is indirect, but important. Long-term acid suppression can be linked with low vitamin B12 or magnesium in some people, and B12 helps nerves and brain cells work properly. When B12 drops, the signs may not look like a stomach problem. They may look like fatigue, tingling, poor balance, low mood, or mental fog that families mistake for decline. This is the hidden part. The person may still swallow food normally and still feel the reflux is controlled, so nobody thinks about nutrient testing. Yet, the nervous system can become less efficient when key nutrients fall too low. Mental clarity depends on more than the brain alone. This does not mean reflux medicine causes dementia in everyone. It means duration deserves review. Ask your doctor, do I still need this dose? Could I step down safely? And should my B12 or magnesium be checked? The safest change is a supervised one. Now watch the next category, because it targets memory more directly. Number 7 is the bladder pill people take because embarrassment becomes exhausting. Waking up 3 times at night, rushing to the restroom, or fearing an accident in public can shrink a person's life. So a bladder medication feels like freedom. The hidden concern is that some older bladder drugs calm the bladder by blocking acetylcholine, the same messenger the brain needs for memory and attention. That is why the symptom can look confusing. The bladder improves, but the mind feels slower. A person may repeat questions, lose focus during conversations, or feel less sharp while the family blames age, sleep, or stress. The medicine may be doing its job in one organ while creating pressure in another. The risk grows when the bladder pill is not alone. Add a nighttime allergy pill, an old antidepressant, or a motion sickness product, and the acetylcholine blockade can become heavier. The body does not care that each product came from a different reason. The brain feels the total. Never stop a bladder medication suddenly without guidance. Instead, ask, is this one strongly anticholinergic, and are there non-drug steps or safer options for me? A doctor can review dose, timing, alternatives, and whether the benefit still outweighs the mental cost. The next medication can feel even more personal because it is often taken for fear itself. Number 6 is the anxiety or sleep medicine that feels like rescue in the moment. When panic, grief, insomnia, or racing thoughts hit after 50, relief matters. Benzodiazepines and related sleep medicines can calm the nervous system quickly, and that is why people trust them. But the same calming effect can also slow memory formation, balance, judgment, and alertness. In plain English, these medicines increase the effect of GABA, the brain's braking signal. Brakes are useful when the brain is overactive, but too much braking can leave an older brain foggy, unsteady, and less able to record new memories. That is why someone may forget a conversation, feel drugged the next morning, or seem unlike themselves. The dangerous misunderstanding is simple. A person says, I slept all night, so why am I still not clear? The answer may be that sleep and sedation are not the same thing. A deeply sedated brain can still wake up poorly refreshed, especially when the dose lingers into morning. This category deserves respect because stopping suddenly can be dangerous. Withdrawal, rebound anxiety, and sleeplessness can be serious. Ask your doctor, is this still necessary? Is the dose too strong for my age? And would a gradual taper or different treatment be safer? The next medication is more controversial, so it needs a steady doctor's view. Number 5 is the cholesterol medicine that should not be judged by fear alone. Statins protect many people from heart attack and stroke, especially when risk is high. That matters because a healthy brain also depends on healthy blood vessels. The mistake is not taking a statin. The mistake is ignoring a clear timing pattern when memory complaints begin after a medication change. Rare memory complaints have been reported with statins, but that does not mean statins are a common cause of dementia. In many patients, the heart and stroke benefits are much more important than the concern. Still, if brain fog, forgetfulness, or confusion appeared after a new dose, a doctor should hear about it. The mechanism is not simple. Cholesterol is involved in cell membranes and nerve signaling, but vascular protection is also brain protection. So the right question is not, should I stop this? The right question is, does my symptom timing fit this medicine? And should we review the dose, type, or other causes? This is where fear can harm people. Some stop a heart protective medicine after reading one scary post, while others ignore symptoms because the medicine is important. Both extremes are wrong. The safer path is a careful review, not a sudden decision. Do not let internet fear make that decision. The next medication is older, stronger, and often hidden under many uses. Number 4 is amitriptyline, an old medicine wearing many different labels. One person receives it for nerve pain. Another gets it for migraine prevention, sleep, mood, or chronic discomfort. Because the dose may be small, people assume the risk is small too. But after 50, even a low dose can matter when the drug has strong anticholinergic effects. This is where families get misled. The prescription may not say memory medicine or brain medicine, so nobody connects it to mental clarity. Yet a person can become dry-mouthed, constipated, sleepy, forgetful, or strangely flat. They may stop reading, stop following conversations, or appear emotionally dulled. The trap is the word low. Low dose does not always mean low burden, especially when the medicine is combined with other anticholinergic drugs. Older adults often have slower clearance, more medical conditions, and less reserve when side effects build quietly. Amitriptyline is not evil, and it helps some patients. But it is exactly the kind of medication I would want reviewed if memory changes began. Ask, is there a safer option for pain, sleep, or migraine at my age, and can this be reduced only with a plan? That last phrase matters. Only with a plan. The next category is not just about fog. It can change a person's whole personality. Number 3 is the antipsychotic used when behavior becomes hard to manage. This one is serious. Sometimes older adults become agitated, suspicious, sleepless, or difficult to calm, especially during illness, hospitalization, or cognitive decline. Families and facilities may feel desperate. A medication that quiets behavior can seem like the only way to keep everyone safe. But antipsychotics affect dopamine and other brain signals involved in movement, motivation, alertness, and emotional expression. In older adults, especially those with dementia, these medicines carry important safety concerns and must be used with great caution. The outward change can be dramatic, less agitation, but also more sleepiness, stiffness, falls, confusion, or a person who seems emotionally gone. This is where convenience can disguise itself as care. If a person is sedated because the environment is noisy, pain is untreated, infection is missed, or sleep is disrupted, the real cause remains. The medication may quiet the room while the underlying problem continues. There are situations where these medicines are appropriate. There are also situations where they are used too easily for convenience. Ask, what symptom are we treating? What non-drug steps were tried? What is the lowest effective dose and when will we reassess? A calming medicine should never become invisible. The next one surprises people because it belongs to a familiar antidepressant family. Number 2 is paroxetine, the antidepressant that deserves special attention after 50. Depression and anxiety are real medical conditions. Treating them can improve sleep, appetite, relationships, and memory itself. So this warning is not against antidepressants. It is about one specific medication that can carry more anticholinergic activity than many people expect. Paroxetine can help some patients, but after 50, it deserves a careful review when brain fog, sleepiness, or mental slowing appears. The hidden trap is that the symptom may be blamed on depression returning. A person feels dull, forgetful, or less motivated, and the dose may be increased without asking whether the medicine is contributing. This is especially important when paroxetine has been taken for years. The body changes, kidney and liver handling may change, and new medicines get added around it. A once stable routine can become too heavy without looking new on paper. This is why medication history matters. The same drug that improves mood in one season may not fit the body the same way years later. Ask your doctor, is paroxetine still the best option for me? Or would another treatment have less cognitive burden? Do not switch suddenly. Antidepressant changes need supervision. Now we reach number 1, and this is the part most people miss. Number 1 is not always one pill. It is the stack. This is the danger I want every family to understand after 50. One doctor prescribes a bladder pill. Another adds amitriptyline for nerve pain. A sleep aid appears from the pharmacy aisle. An allergy tablet is used during spring. A reflux pill stays on the list for years. Then a person becomes foggy, slower, sleepy, unsteady, or forgetful, and everyone starts whispering about dementia. But no one has added up the burden. The brain does not experience your medication list as separate little stories. It experiences the total chemical pressure of sedation, anticholinergic load, dopamine changes, nutrient issues, and drug interactions. Each item may look reasonable alone, but together they can push an older brain past its reserve. That is the mislabeling trap. Medication-related fog may be called aging. It may be called stress. It may be called depression, poor sleep, or early dementia. Sometimes those diagnoses are real, but before accepting the worst explanation, the medicine cabinet deserves a careful review. A safer review also protects dignity. When medicine is the problem, families stop blaming the person, and the person stops blaming their own character. They can ask better questions, change one thing at a time, and watch whether clarity improves. That careful process is how you separate true disease from a reversible burden. It also helps the doctor see patterns that a rushed visit misses, especially when prescriptions come from separate specialists and store-bought products never appear in the medical chart. That missing list can change the whole medical conversation. Here is the 1-0-second tip. Tonight, take one sheet of paper and draw 3 columns: prescription, over-the-counter, and occasional. Then write every pill, drop, patch, cream, sleep product, allergy product, stomach pill, pain reliever, and supplement you use, even if you take it only sometimes. That list is not for panic, it is for power. Bring it to your doctor or pharmacist and ask, could the combination be affecting my memory, focus, alertness, balance, or confusion? Also ask which medicines can be reduced, replaced, timed differently, or tapered safely. The biggest mistake is stopping suddenly. The second biggest mistake is never asking. After 50, your brain deserves more than a medicine list that nobody has truly reviewed. You have now seen the real pattern behind these 9 medication concerns. The danger is not that every pill is bad, and it is not that every memory lapse means dementia. The deeper risk is treating familiar medicines as invisible while the brain is quietly carrying the full load. That is a different message, and it is a hopeful one. You do not need to throw away your medicines. You do not need to scare yourself tonight. You need to make the medicine cabinet visible again, because a full review can reveal problems that fear alone will never solve. Start with one simple action this week. Write down every prescription, over-the-counter product, supplement, sleep aid, allergy pill, reflux pill, pain reliever, bladder medicine, anxiety medicine, and occasional PM product. Mark anything that affects sleep, mood, bladder, allergies, pain, reflux, agitation, or anxiety. Then schedule a medication review with your primary doctor, pharmacist, or a geriatric specialist. Ask the question directly, could any of these be affecting my memory, focus, alertness, or confusion after 50? Then ask about safer alternatives, lower doses, shorter duration, supervised tapering, or deprescribing when appropriate. If that concern is dismissed without a real review, a second opinion is reasonable. Clear written notes make the visit easier and help your clinician protect you without guessing, rushing, or overlooking patterns. That is not disrespectful. That is responsible. If someone you love takes several medications and has started feeling foggy, share this video with them before they assume the worst. If you want calm, doctor-led guidance early, subscribe to the channel so you can learn these warnings before they become bigger problems. And comment review if you are going to check your medication list this week, or if one person in your family needs this reminder. Thank you for spending this time with me. Your brain is worth protecting, your questions are worth asking, and your health decisions should never be made in fear. Take your list, bring it to someone qualified, and move forward carefully. I will see you in the next conversation.